Good morning. I'm going to talk to you mostly about movement, and I'm going to talk to you about exercise. So my research is on why movement is difficult in people with Parkinson's disease. So I'm really interested in the mechanisms for why movements can't get started and why they fall apart once they get started. Important thing for you to know is I'm a PhD physiologist. I'm not a neurologist, although I'm in the Department of Neurology because that's where the field for my research comes to the neurology department at the University of Minnesota. So anyways, ask lots of questions and I'll try to answer them as we go. So slides are a little difficult to see, but and I'll kind of talk you through them. So I am the director of the Movement Disorders Lab at the University of Minnesota, but I'm also part of what's known as the Udall Parkinson Center of Excellence in Research. We got that about a year and a half ago now. And it designates us not only as required to have world standard research within our program, but also world standard outreach and care. And so this is part of what we try to do is try to educate people, try to get information we're learning out to you, and make it in a way that makes your life better. So the bottom actually is a picture of not everybody in the Udall Center of Excellence, most of us, but not everybody. And you'll see there's probably a better part of 30 people plus in our group now. We work really well together across the whole spectrum of Parkinson's disease. And it's really, really continuing to grow. And we're really proud of what's been created at the university. And we're very thankful for the support from the National Institutes of Health and from the Parkinson's Foundation for keeping a lot of our programs going. Okay, so in general, I'm going to try to meet a couple of objectives through my talk. But first of all, because I'm a professor and professors tend to talk too much and they try to educate everybody. And so I'm going to do a little educational thing and try to teach you about the 5 core elements of movement. And hopefully you can remember those 5 at the end of the day. I'm going to kind of go through them. And if you get all 5 ingredients, you should move well. And I'm going to give you some prescriptions for how to get all those 5 components working for you. Then I'm going to talk briefly about strengthening exercise. I'm going to talk about balance exercise. I'm going to talk about endurance exercise and what's out there. And I'm going to provide, where it's available, actually scientific evidence that exercise is good. So once again, a large proportion of these slides, a large proportion of the expertise comes from my interactions with Daniel Kurko. So that's Daniel there from the Northwestern University. So what do you want from exercise? So first and foremost, you want immediate effects of exercise. So you want it to reduce your symptoms. So you want your signs and symptoms, your movement to be better. And that clearly, there's evidence to support that. But you also want to have long-term effects. So exercise has long-term effects on the quality of your movements. And you want to prevent the symptoms from getting worse over time. And I'll present you evidence that that's true, actually. Right now, we have no cure for Parkinson's disease. Right now, we have no drug that slows the progression of the disease that we know of. Although there's some clinical trials on it right now that are really promising, but we actually today have no evidence of any drug that slows progression of the disease. But we do have clinical scientific evidence for something that's non-drug that slows progression of the disease, and that's exercise. And that's probably the most important thing I can pass on to you today. We have evidence that if you exercise, it will slow progression of the disease. And this is well shown in animals, and we now have evidence in humans that that's the case. So we want to, in terms of disease progression, we want to slow it down. We want to reduce the disability that's associated with the disease through exercise. And then there's also this idea that maybe exercise might even be something called neuroprotective. So if you have a neuron in the brain and that neuron is vulnerable to Parkinson's disease, and Parkinson's disease is a very strange thing. Some neurons are very vulnerable to dysfunction and death by whatever causes Parkinson's disease. And it can have a neighboring neuron that's very similar. In fact, if you look at them, they look identical. So actually, there's a region in the brain called the substantia nigra pars compacta, and it's full of dopamine neurons. And it's the dopamine neurons that die in people with Parkinson's disease and cause the signs and symptoms. And right beside the substantia nigra, there's another part of the brain called the ventral tegmentum. And it's full of dopaminergic neurons. And those neurons don't die. So there's something specific about substantia nigra dopaminergic neurons that makes them vulnerable to die. We have animal models of Parkinson's disease, and we look at substantia nigra neurons, and we put these animals through a really vigorous program of exercise, and we try to induce Parkinson's disease in those animals, it's much more difficult. So if they've been going through vigorous exercise, it's much more difficult for us to experimentally induce Parkinsonism. And if those animals have Parkinsonism and the exercise, the progression of the disorder is a lot slower. So there's something really special about exercise that seems to be good for dopamine neurons. If you rescue dopamine neurons, you have more dopamine in your brain. You need less medications. Your signs and symptoms should be less. Okay, so some of the basics of Parkinson's disease, which I'm sure you're all aware of, is it has 5 sort of cardinal motor symptoms. So the movement symptoms that characterize the disease, the way it's normally described in textbooks or online, is there's something called akinesia, which is the lack of voluntary spontaneous movement. Bradykinesia, which is a term for the slowness of movement. Rigidity, which is the stiffness of the limbs that goes with the disease. Tremor. Now, not everybody has tremor. About 25% of people with Parkinson's disease have no tremor whatsoever, but they still have Parkinson's disease. So you don't have to have tremor to have Parkinson's disease. And last but not least is something called postural instability and gait dysfunction, problems with balance, problems with walking. So those are the 5 sort of classic characteristics of Parkinson's disease. So I threw up the video here of a gentleman with fairly advanced Parkinson's disease, just to remind you of if you were to describe Parkinson's disease to someone who knew nothing about it, you would typically say, well, often they have tremor, this resting tremor, and that's very true, but not in all people. What's really sort of the classic characteristic of Parkinson's disease is the lack of voluntary spontaneous movement. So not as much movement as you would like. And the movements are slow, and the movements are small. So small movements is the term we use is hypokinesia, too little movement. Bradykinesia, the movements are slow. So if you describe movements that way, I'll just go to this. The other thing is typically we describe the 5 cardinal motor symptoms. One of the major breakthroughs that we've had in the last 15 years is recognizing that it's not just a movement disorder. It's not just a movement disease. It affects a lot of other things. Bill Langston, actually out in California, was the first to give the term the Parkinson's complex, where the tip of the iceberg is the substantia nigra motor symptoms. But there's a lot of other stuff that's going on, which can include cognitive impairment, problems with thinking. It can include depression, pain, sleep problems, autonomic problems, blood pressure problems. There's a wide spectrum of things. And the thing that I always tell my students when I'm teaching them about Parkinson's disease is everybody's different. Everybody that comes in the door presents differently. And the quote I got from my boss that he actually got from one of the patients he treats is, he said, if you've seen one person with Parkinson's disease, you've seen one person with Parkinson's disease. And when we're doing our research, that's extremely true. Everybody's different. Treatment needs to be different. Everybody needs to be treated as an individual relative to the symptoms that they present with. So I'm going to focus today on movement. I'm also going to focus on the smallness of the movement, the slowness of the movement, and the balance problems that come with it. And as a bonus, we're also going to talk about cognitive impairment, which is your problems with thinking. Okay, so here's my professorial part of the lecture. So teach you a little bit about the physics of movement. So there are different terms, mechanical terms for describing how you generate movement. One is based on work. So you get a certain amount of work done when you are moving. So if I want to start at the bottom of Mount Everest and I want to go to the top of Mount Everest, I can do that in 8 hours, or I could do it in 14 days. The work done is the same. So I've taken my mass and I've moved it a certain height above sea level, and that's the amount of work done. But you notice that if I do it in 8 hours or if I do it in 14 days, that's really different. And the difference is a term called power. It's the rate at which you do work. So I can go and I can reach for the podium slowly, or I can reach quickly. One looks Parkinsonian, and one looks non-Parkinsonian. The work done was identical. The difference was the rate at which I did the work, the rate at which energy changed in my body to do something. And that term is called power. Its mechanical term is power. So to go to the equation, power is equal to the force times velocity. Force times velocity. And you think, why is he teaching me this? And it's really important that you need to realize to make great movement, you need two things. Force means you need strength. Velocity means you need to have range of motion. So great movement requires two things, strength and range of motion. So any exercise program that you are doing, if you want to have better movement, you have to focus on those two things. And I'm going to give you a laundry list actually of 5 things that put everything together. But those are the major things mechanically that have to happen. To get force, you need muscle strength. To get velocity, you need range of motion. Is that clear for everybody? Okay, so that's power. We want everybody in this room to have lots of power. You want to be able to run up to the top of Mount Everest in 8 hours. You don't want to take 14 days to get there. That's the difference. So how are we going to get there? How are we going to give you power? Well, first of all, we need strength. So power is strength times range of motion, force times velocity. And here's the bad news. In a healthy adult population, as you age, your strength, this is measured as a maximal voluntary contraction of force, and you can see at about age 50, 55 here, I'm right about here, I'm on the precipice, you start to get, your strength starts to drop naturally. Your muscle fibers change, your muscle fiber composition changes, but most importantly, we become more sedate. And as we become more sedate, we become weaker. And as we become weaker, we can't generate force, and when we can't generate force, we can't generate power. So this is working against us. And this is hard to see, but this is actually research that's done by Daniel Korkos looking at basically strength of the limbs. He looked at elbow strength, he's looked at leg strength, and it's pretty much the same story. I'll just get everybody see this dashed line here. This data point here is the strength of a person with Parkinson's disease in their flexor muscles, these types of muscles here, flexor muscles, when they're off medication. And here's the strength that's in a matched control subject, someone that's the same age and sex. And here's the strength in the extensors, and here in a Parkinson's person, and this is the strength in a person that's matched. So the take-home message is, if you're off medication, is that you tend to be weaker than a person that is your match. And so that's the first take-home message. Second take-home message is your extensor muscles tend to be weaker than your flexor muscles. So flexor muscles are ones like this. Flexor muscles allow me to do this. Extensor muscles do this. And why extensor muscles are so important is what extensor muscles, I'm going to show you my 3 main extensors in my leg, and this is going to drive the camera around crazy because I always have to move when I talk. I'll show you the 3 main extensors. One is your plantar flexors. And watch what all of these do. So I'm going to turn on just my plantar flexors. I'm going to turn on just my knee extensors. I'm going to just turn on my hip extensors. What do they have in common? They accelerate me up, right? They push me up. Because gravity's pushing me down, my extensors push me up. So your extensors are the muscle group that fights gravity. If your extensors get weak, what happens? generate that classic Parkinsonian stooped posture, head forward, shoulders forward, flexed at the hips. That's largely, we think, due to a progressive weakening of the extensor muscles. So your extensor muscles need to be strong. They need to be there to fight gravity and to hold you in a proper erect posture. So strengthening flexors and extensors, important. You really got to focus on your extensors. Is that clear enough so far? Great, okay, good. So that's the bad news. This is probably my last bad news slide, so I promise. And the issue is, if you get Parkinson's disease, you get into this vicious circle, where if you have Parkinson's disease, you have problems with walking, you have problems with walking, you become sedentary, and you become sedentary, then you walk less, and become more sedentary, and you walk less, and everything sort of collapses on itself. So the key is to keep you out of the vicious cycle in which your motor features get worse. You become more sedentary. And along with that, you also get non-motor features. The less you move, the more cognitive impairment you're likely to have, more likely to have dementia. So you have to stay away from that cycle of less and less. Try to keep away from a sedentary lifestyle. So everybody knows this slide. Exercise is beneficial. So it's kind of a mantra that everybody uses all the time now, and it's absolutely true. And for people with Parkinson's disease, it's become critically important, I think, that we get this message across. Exercise is beneficial. But as Oscar Wilde said, to get back my youth, I would do anything in the world except take exercise. Get up early or be respectable. And Oscar Wilde is not alone. I mean, people don't want to do exercise. I don't have time in the day. You know, it's just kind of, it's uncomfortable, makes me feel bad. So here's a couple general rules. One is exercise takes at least 3 weeks to kick in. So if you go into an exercise program and you feel terrible with your exercise for 3 weeks, can't guarantee this, but after 3 weeks of regular exercise, that horrible, boy, I'm really tired, this is feeling awful, I don't feel anything is happening. If you do it rigorously for 3 weeks solid, just stay with it, get past that 3 weeks, and you should start to feel the benefits. It's that first 3 weeks that's really tough. So you got to get past Oscar Wilde's notion that it's just something you don't want to do. Question, yeah. The bad news with exercise is that you lose it more quickly than you gain. So if it takes you 6 months to get your strength where you want it, you will lose it probably at twice that speed. So the body's remarkably good at just taking away all these advantages of exercise. So you have to stick with the program. And that's really important. That's a great question. So you lose it more quickly than you gain. So you have to stick with it. Probably people here have had a cast on at some point in time in their life, right? And so if it's especially a leg cast. And you should probably notice how remarkably quickly you lose your muscle mass if you have a cast on. It's frightening. And the time it takes you to get that muscle mass back is at least twofold the time it took to put it on, at least twofold. Okay. So I have 2 kids that love to cook, so we always talk recipes these days. So here's my recipe for a great movement casserole. And it only has 5 ingredients. So that's all you have to remember is the 5 ingredients of the movement casserole. And we're going to go through each of the ingredients one at a time, but you need all 5 if you want a great casserole, if you want great movement. So you need strength. That's your force, right? You need range of motion. That gives you your velocity. So there's our power. But you also need balance. So you can't walk if you can't balance. You can't climb stairs if you can't balance. So balance is essential. Endurance. So if you want to do something for a longer period of time, you've got to build out your endurance. And really, really important as well is adaptability. So what we do know when you learn a motor task, the learning happens most when it's difficult, when you're trying to do something that's a little bit beyond your capabilities, something that is pushing you and perturbing you. That's when you learn the most, and that's when you retain the most. So adaptability is super, super important. So there's our 5 ingredients for our movement casserole. Okay, so we're going to go one by one. So we're going to start with strength. So let's get force in the body. So I'm going to take you through, because I'm a scientist, I'm going to have to take you through some of the boring clinical details, but some of these details are super important. So I'm going to talk about a study that was done by Daniel Korkos' group. It was out of Northwestern University, but also involved a large number of centers, and now has expanded nationwide, actually, because of the success of this particular trial. And they were interested in looking at progressive resistance exercise, so basically weight training, and comparing it to a standard exercise program called fitness counts. So this is the goal, is to compare these two, progressive resistance exercise, weight training, versus fitness counts. And it was a 2-year training program. And the major outcome score was something called the Unified Parkinson's Disease Rating Scale. That's the scale we use clinically to rate the severity of the motor impairment in a person with Parkinson's disease. So it's a scale from 0 to 108. So a higher score is worse. So that's our major outcome score is how well does it treat severity of motor symptoms in people with Parkinson's disease. So patients were randomized to either get resistance training or the fitness counts. The nice thing about it, actually, they got funding to actually have a personal trainer with the person while they're doing the training. So they could say, okay, I want you to lift the weights this particular way. This is how much you should lift. And this was for at least half of the program. People had a personal trainer with them, which is a nice add. Neither the personnel trainer nor the patient were aware of the hypothesis of what they were looking for. Everybody knew they were in an exercise program. Everybody knew they were going to in the exercise program for 2 years. No one knew exactly what the researchers were looking for. Okay, so a couple key things about the program. So once again, it's 24 months of exercise, 2 times per week for an hour and a half. I'm going to repeat that. 2 years, 2 times per week, an hour and a half each time. That's nothing, right? Everybody here can fit in 2 times per week for an hour and a half. There is no excuses, okay? So this is very little training, okay? No other exercises were done. Once again, 6 months with the personal trainer, and the rest was the personal trainer once weekly with instructions to continue doing what they're supposed to be doing. Okay, so one group got progressive resistance exercise. The acronym is PRE or PRE. And there's 11 strengthening exercises. The key feature is you increase the weight as you tolerate. So if you can do 5 repetitions maximum of a certain weight, and that becomes really easy, then a couple weeks later you might increase the weight. So now you're doing 5 repetitions maximum of a slightly more weight. And they'll be different for everybody. So some people can lift 10 pounds and other people can lift 25 pounds. But as the program goes on, it's progressive. You're increasing how much weight you're lifting over time. And it's very individualized. And that's one of the reasons why having a personal trainer there is good. Does everybody follow that? So that's the key feature, progressive resistance exercise. And basically, it was targeting all major muscle groups, lower limb, upper limb, and axial, the trunk muscles. And this is just a laundry list here of some of the exercise: chest press, latissimus dorsi pull downs, reverse flies, leg presses, etc. But 11 exercises conducted with breaks over an hour and a half in their local gym with a trainer for the first 6 months. So the other half of the group went into a program called the Modified Fitness Counts program. And the Modified Fitness Counts is a recommended exercise program. It's a fairly standard program. It involves stretching, involves non-progressive strengthening. So if you're doing 5 repetitions maximum of 20 pounds, that's what you did for the whole 2-year program, always the same weight. There was breathing exercises, there was balance exercise, and each session was identical, so non-progressive, that's the feature. But once again, this is a recommended exercise program, regular program that people do all across the country all the time, modified fitness counts. So is everybody clear? So we have one with progressive weight training, we have one with balance, stretching, non-progressive weight training. Otherwise, everybody else is matched. Testing was done with people off their medication at the end, at the beginning, 6 months, 12 months, 18 months, and at the end of 2 years. Okay, so first thing, yes, question? We do not know what the minimum requirement is, and it's a question I really don't want to answer because I would rather you say, what's the maximum I can do? Yeah, we don't know what the minimum is. We were actually really surprised that this 2 1.5-hour sessions per week produced pretty dramatic changes. The key feature here being it's a 2-year program. This is more than 3 weeks. This is 2 years. Everybody had to be there 2 sessions per week for 2 years, which that's a big commitment, but they had to commit to it. And the compliance was fantastic. It was fantastic. People did really well with the program. Yeah, question? Is it possible to do too much? Yeah, so yes. Is it possible to do too much? So any exercise program has to be done safely. So if you have cardiovascular issues, if you have other issues, orthopedic issues, like rheumatoid arthritis, you have to have an exercise program that's tailored for you that's safe. So it's very easy if you're overeager to push too much weight. It's very easy to push your heart rate way too high if you have risk factors. So one of my bottom lines, and I'll say at the end of the talk, is you need to do this under supervision. You need to get permission from your doctor saying, you know, I want to go on this endurance training program or this weight training program. What do I need to watch out for? So you need to be safe. But the other flip side is the more intensity, the better. The more you do, the better. So did people get stronger? So this is, think of this on this y-axis here. Higher numbers are good in terms of how much strength you have or how much torque you can put out. This is for, let me get this right. These are the elbow muscles. These are the flexors. Here's are the extensors, but the idea is the same. So time 0 here is at the beginning. So this is how much strength you have at the beginning here. It's just set to 0 because we're looking at change in strength. And then we look at both groups. So this is the progressive resistance program in red, and in black is the fitness counts group. And you notice at 6 months after the start of training, both groups have improved the amount of strength. So both have a positive change in strength at 6 months. So that's great. So whether it's in the flexors or the extensors, both have improved. But if you're doing the progressive resistance exercise, notice how the improvement changes over the whole 2 years. If you're not doing progressive exercise, the strength goes down over time. So you've actually lost strength in the fitness counts programs at the end of 24 months. And if anything, you've increased your strength. And this is 2 years later. 2 years later, your strength is improved and stayed improved with progressive resistance exercise. So that's really good. So improved strength and maintained improved strength with a progressive resistance exercise. So great. So we've got one of our ingredients for power now. More strength. More strength means more force. More force means we can generate more power. Okay. So here's the most important slide in my whole talk. So after this slide, if you want to wander away or fall asleep, that's fine. But this is super important. So this is a plot here of time in the exercise program, baseline all the way out to 24 months. And on this axis here is the change in the rating of the severity of your movement impairment. So this is the UPDRS motor score. So 0 on here means no change. A negative number down here means it got worse, and a positive here means you got better. Sorry, let me get this. I'm going to flip that. I just said that wrongly. So, sorry, if it's getting worse, it's going positive. So your score is getting higher. If it's going negative, it means that your score is actually going down, and that's good. Sorry, but everybody got that? So up is bad, down is good. Okay. So if we were to just monitor an average group of people with Parkinson's disease on no exercise program, and we rated them with their Parkinson's disease severity at time 0, and then we did it 2 years later. On average, because it's a progressive disease, they would have almost a 6-point increase in the severity of disease. Now, a 5-point change we know is clinically significant, functionally significant. So if you do nothing other than what you always do every day, then you, at 2 years later, you're going to be worse by at least 6 points. Okay? So let's put you on an exercise program. And here's what we got. So the red, once again, is the progressive resistance exercise program. The black is the fitness counts. At time 6 months, so 6 months after starting the exercise, 2 times per week, 3 hours per week, there's a more than 6-point drop in the severity of the disease. 6 months of exercise, 6-point drop in the severity of the disease. Now, once again, 5-point drop we know is clinically and functionally significant. So after 6 months, people are feeling pretty good. Okay, remember, this is a disease that's supposedly progressing. People should be getting worse. This should be going on the positive side. No, they've gone the opposite direction. If you're in the Modified Fitness Counts program, so a non-progressive exercise program, it starts to creep back to 0 over the 24 months. Everybody goes, well, that's really bad. That's too bad. And it is. But it's not that bad because at 2 years, 2 years later, 2 more years of Parkinson's disease, their motor score was the same as 2 years earlier. You're back to where you were. And that's fantastic. So you're not 6 points worse. If anything, you're 6 points better. That's just doing 2 times per week, non-progressive resistance exercise. And you're doing really well. Your disease as a motor feature, on average, has not gotten worse. We have no drug that can do that. There is no drug on the market that can prevent this green dot from happening. Exercise does. Now look at the progressive resistance exercise. At 24 months, it's 7 points better than 2 years earlier. 7 points better than 2 years earlier. 2 times per week, an hour and a half. That was it. So that is a remarkable finding. I mean, it's absolutely, every time I see this data, I just go, wow, this is what we need. People need to get the message. They need to get out there, and they need to do exercise at least twice a week for an hour and a half. Everybody got that? If it sounds like I think it's important, it's because it's really, really important. So everybody follow the story? Yeah, questions? Yeah. 6 days at half an hour equivalent to, we don't have a matching clinical trial looking at that, but I think if the intensity of the exercise and the progression of the exercise is the same, so once again, intensity and progression of the exercise is same, if you do it for a shorter period of time, more often per week, there's no reason why you shouldn't get the benefit. Absolutely no reason. We don't have the data to show that, but there's absolutely no reason. Physiologically, I can't think of a reason why a shorter period more often wouldn't be as benefit. Yeah. Yes. Yes. So the question is, does exercise have anything like this effect on movement? Does it have an effect of we think, either slowing progression or preventing progression of cognitive deficits or dementia? And there's not as much data as there is for movement, but the general answer is if you are in a regular exercise program, at least 2 times per week, is that our measures of cognitive impairment, if anything, you're doing better than you were at baseline, and the progression is slower. So, and this is actually showing up really well now in the Alzheimer's field, where a program of exercise, a regular, vigorous program of exercise, slows the progression of cognitive impairment. And we're starting to see the same thing in our Parkinson's data. So it's a perfect question. Yeah. So the question is, why such a big jump in the first 6 months? And we don't really know the answer. All we can do is judge on our outcome measures. But it partly has to do with we think, I wouldn't say it's a placebo effect, but this idea that I'm in an exercise program, I should be getting better, I'm feeling better. And so the general perception of the person at 6 months, and that's the first time they are evaluated, is I should be doing better. And when we evaluate, they are doing better. So it's like any exercise program. When you get past the threshold of feeling better, that's the time when it feels best, actually. And then that seems to show up most at 6 months. Yeah. So the question is, there's a disorder that has Parkinson's features called progressive supranuclear palsy, or PSP, and is exercise beneficial for those that have PSP? And the answer is we don't have the data yet. So it's one of those things where we have no evidence that it would not be beneficial, so why not? So once again, in animal models, we know that exercise is something called neuroprotective. So if there's neurons that are on the threshold of dying, or neurons that are dysfunctional, exercise tends to protect those neurons from dying. So people with certainly earliest stage PSP, we really encourage them to get out and exercise with the same type of program as a person with Parkinson's disease. PSP tends to be a much more rapidly progressing disease, so I think the importance of catching it early and getting an exercise program, a safe exercise program, because balance is a big problem in that disorder, is really, really important. Well, So it's a great question. So if you're a really fit person, there are really, really fit people that get Parkinson's disease. There are really, really active people that get Parkinson's disease. Once again, we don't know what causes or triggers Parkinson's disease. The only way I can answer that question is I can flip it on its ear and say, if you were super active and you got Parkinson's disease at the age of 55, if you weren't active, and you didn't have all that neuroprotective, all those good things that exercise do for your body, we don't know this, but maybe you wouldn't Parkinson's would have showed up when you were 40 or 45. So, and we don't have data that more fit people get Parkinson's less. So we don't have any data that says that. But we do have pretty compelling data that are aspects of exercise that are neuroprotective. It prevents the disease from starting and from progressing. But it obviously doesn't completely prevent it from occurring. So we still have a lot to learn about what it does, what triggers it, but still I think having an active lifestyle, even before diagnosis, is really important to preventing the disease from progressing. Is there a resource for finding out what the exercises were for the progressive resistance exercise? I will find out for you. I think Dr. Korkos has set something up, but I can't remember exactly where it is. But I can even just share slides with you that has the list of exercises. But it'd be nice actually to say, you need to do exactly this. It's all in the publication, but that's not something you want to, read unless you're sleep deprived. So. Yeah, so we can find a resource for you for sure. Okay, so here's the bottom line for everybody. Is not everybody wants to do weight training. Not everybody wants to do, Nordic skiing as their exercise. It's just not possible for everybody. So you need to find something that you can do, and you need to find something that you're going to do regularly. So if walking is what works for you, then that's a good thing to do. So that's the bottom line. You need to get out and you need to move. And remember, the ingredients are strength and range of motion. That gives you power. The walking over time is also going to give you endurance. So the other key ingredient, though, and this is where it gets hard, is it needs to be progressive. So you say, okay, what I'm going to do, I'm going to set a goal, and I'm going to walk around the block 3 times a week. And that's really hard, but I'm going to walk around the block 3 times a week. And then you do that for 3 weeks. And after that 3 weeks, I say, you know, I'm going to go twice around the block 3 times a week. Or I'm going to go once around the block 3 times a week, but I'm going to go a little bit faster. So what this data shows us is A, doing exercise in general is really good. So if you are out for a walk regularly, that's excellent. If you can progress, that's even better. So that's what this data is showing us. Doing something's good, progressing is better. So if there's a way you can progress your walking in a way that's a little bit more vigorous and a little bit longer, and you just continue to evolve, that's the key. And once again, the hard part is getting past that first 3 weeks of just regular walking where you're tired and you don't want to do it and there's snow on the ground and your muscles are sore and you just got to stick with it. So I think Dr. Korkos does this analogy, which I really like. So if the doctor tells you, I want you to take your Cinemet at 9 o'clock, 1 o'clock, and 7 o'clock, then you write down, okay, I'm taking my meds at 9 o'clock, 1 o'clock, and 7 o'clock, because you've been getting a prescription, because that's good for you. It makes you feel better. It makes your Parkinson's symptoms less. Why don't we do the same with exercise? We want you exercising at 1 o'clock on Monday, 1 o'clock on Wednesday, and 1 o'clock on Friday. That's what the doctor prescribed. It's the same as a pill. It's good for you. You need to stick with it. So I don't know if that answers your question, but walking's great. Keep walking. Try to progress if you can. That's a great question. So did they change their medication? So that study did not have any control over medication. So over those 2 years, they may have progressed into the disease and been given more medication. And so there were people in that group that ended up with more medication. There were also people in that group that ended up with less medication. So actually, do I have the data? Here it is. So actually, this is the data showing the change in medication over the 2 years. So this is the modified fitness count. So on average, the amount of medication increased over 2 years, which would be expected. And notice that the progressive resistance, the change in medication is less. So those on the resistance exercise, over time, we're taking less medication than the matched group. But there's still, on average, people's medications are increasing. So is there a compound benefit in terms of just the psychology, feeling better about life? And the answer is yes, and for 2 reasons. One is physically, people tend to feel better. And if they're exercising in a social context, so I've got lots of other slides I'm not going to get to today, but boxing or Tai Chi or anything where you have a lot of social interaction, you make new friends, you got a place to hang out, and that also is really, really positive. So one of the things that happened at the end of Dr. Korkos' trial, he said, we're done. It's 2 years. We have no money left. And they went, but I'm having such a good time. I'm feeling so good. Can we just keep going? And so most of those people signed up for a continued program at their local fitness center. And they would pay every now and then for a trainer to come in. So most of those people were thrilled with the program, were very consistent in doing it, and very sad when it was over. And a large number of them have continued to do it. There was a paper that was out last week, actually, the Journal of Gerontology, which said if you start an exercise program and you're an older adult, what is the likelihood of you having completed that exercise program at the end of 1 year? And the sad news is that the vast majority of people, 1 year later, were no longer doing the exercise program. Once the supervision was gone, they stepped away from the exercise program 1 year later. So staying in an exercise program is hard. And so if you have social interaction, if you're doing an exercise that you love, it's more likely that you're going to stay with it. So people say, what should I do? And I say, well, what do you like to do? Do you like to curl? Well, go and curl. If you would like to, I don't know, archery, well, go do archery, but walk there and then, just do something that you're passionate about and that you're going to do consistently. And you'll feel good about it. And thank you for that comment. I mean, for some people, that's a really critical piece of the puzzle. Is they're feeling too weak. They're feeling that their balance is not good enough. They're feeling that their range of motion is constrained. Physical therapists, I mean, that's what they have the knowledge to improve that for you. Improve your strength, improve your range of motion, improve your functional abilities. And once you get to a stage, now you can go eventually individually to a gym without a physical therapist. So a physical therapy program can be really important for people getting started and maintaining long term. Thanks, that's awesome.
I think the results for the fitness counts group are pretty significant too.
Absolutely, yeah, fitness counts.
The fact that they would level after 2 years, and that goes back to what someone else mentioned about some people just can't do the PRE, or you mentioned the orthopedic. So I think the idea that I don't think we should discount that form of exercise for a number of the patients, because they're just not going to be able to do the progressive resistance.
I agree. The key is you need to keep moving. So what we do know is when you become sedentary, when you are in a chair and you're no longer walking, you're no longer standing, you're no longer balancing, that's when the vicious cycle happens. It has nothing to do with Parkinson's disease in part. As soon as you stop moving, your muscles atrophy, your range of motion becomes less, your movements become slower just by the fact that you're not moving, and you're no longer able to generate muscle power. You can't generate the quality movement that you want. So the key is, first off, get moving, keep moving. If you can, go to a progressive form of exercise, as long as you can. Okay, so I think the main points have been made, but I'm just going to reiterate a few things and give you a little bit more information as we go here. But Dr. Korkos and colleagues have also looked at a progressive resistance exercise, but rather than just standing there, often under a very stable paradigm, they have you sit on a balance ball, and do the exercise. So basically making it a little bit more unstable. Now, if you remember at the beginning, I was talking about when you're doing any kind of balance program, any kind of training program, the more difficult it is, the more your motor system will learn. So once again, coming back to walking. So one way to progressive your walking is you walk around the Mall of America, one loop, 3 times a week. And that's great. But the problem with that is it's a level floor. There are no perturbations early in the morning. There's nothing that's going to knock you down. So there's very little in terms of alterations in the environment. So once you get really good at walking that mile around the Mall of America, then there's a nature path around the corner. And go to the nature path. Take the easy nature path where the ground is now undulating. There's bumps and ripples, and you have to step over obstacles. So that's what we mean by adaptability. The system learns how to keep the body stable when it's manipulating different environments. And the motor system learns really, really well when you do that. And that's a form of progression. It doesn't have to be more weight, but that form of progression just make it a little bit more difficult. Another example I'll give is walking in a pool. So walking in a pool, as it turns out, it helps support your weight. So if you have orthopedic issues or you're having troubles with just standing balance, walking in a pool is good, but we also now know because the water's always moving, it actually makes you feel a little unstable, right? So if you're walking in a pool, that's actually a fairly challenging environment for you to do exercise, for you to do a walking program, and you will progress. And so just a therapeutic program in a pool is fabulous for training balance and postural stability and improving your fitness. Okay, so if you do this with intensity, once again, I won't go into belabor this, but this is another study that looked at a control group, and this is before and after, and this is the people that with higher intensity tended to improve more. Once again, a high score is bad, low score is good. People that did the higher intensity with the perturbation, doing that on the balance ball, tended to do better than others. And equally important, once again, this is a score of cognition. So there's a question about thinking. Does exercise better for thinking, for your cognitive abilities? So this is, once again, it's looking, so these scores, higher is better. And so this is a control group before and after exercise program. And you see it's down around 23 or here. In a normal young adult population, 26 is kind of the norm. This is a regular training group, and it's just a little bit below the norm. And this is the higher intensity exercise group. Before, they're just a little bit below the norm, and after exercise, they're a little bit above the norm. So once again, evidence that a program with some intensity that's done over time is better for your capacity to think. Okay, so I'm going to whiz by here because I'm basically just getting the major parts of my casserole built, but your questions have been really good. So I'm going to kind of go through these because I've touched on all of them. So the rest of my slides were all about showing boring data. So strength, super important. So we showed you really good evidence that strength training basically over a 2-year period it can even improve your symptoms, improve your ability to produce force, so your movement should get better. Range of motion with an exercise program, so making sure you can move bigger and wider is super important. How many people here are familiar with the LSVT program? Lee Silverman Voice Therapy. Okay, great. So there's something called LSVT Big and Loud. It's a program that is designed for improving movement in people with Parkinson's disease. And it has the same ingredients I talked about. So the goals of the LSVT program are to make big movements. So you make movements that are like this and like that. And notice the range of motion is really big. And if you stay with the program, your range of motion will get larger. The other feature is intensity. So you don't do movements like this or like that. You do it like this and like that. And you're doing it with intensity. So this is the person climbing slowly to the top of Mount Everest. Right? No power. This is a person with lots of strength and lots of range of motion. Boom. Boom. That's power. Strength, range of motion, movement velocity. That's what the LSVT program is really focused on. And so it's great for people to generate movement power. Balance. So there are lots of ways to improve balance. I talked about aquatic therapy. We have data now on Tai Chi. So Tai Chi, a program of Tai Chi is a great way to have a bit of meditation. It's relaxing, but it's also extremely good for improving balance. We actually have proof that you get long-term improvements in balance with the Tai Chi program. So people say, well, I'm not really into Tai Chi. So we have the same data for tango dancing. And we have the same data for square dancing. So once again, it depends on what you like. One of the most therapeutic programs I'm aware of that's in the city right now is the boxing program. So once again, boxing, range of motion and intensity, strength, velocity, power while you're standing. So you're learning to have better balance, you're learning to have better strength, you're learning to have agility, you're getting stronger, you're getting more range of motion, movement's getting better. So these are all really, really good. Endurance. So as I said, there's a big clinical trial on nationally looking at endurance training in people with Parkinson's disease. The preliminary data looks really promising once again, so motor signs are dropping, people are feeling better. People are able to exercise at 80% of maximal heart rate safely in Parkinson's disease. So that's pretty high. So there was a question when they started the trial, can people with Parkinson's disease exercise vigorously and safely? And so far, they've looked at over 200 people. And people can maintain a program in which the intensity is at 80% of maximal heart rate. 60% of maximal heart rate, you can exercise and talk at the same time. 80% of heart rate, you're not talking. You're really working pretty hard. And people are doing really well with that. So intensity is possible. If you say, I can't do it, we can tell you now, well, given the right program, you can do it with some intensity, and you can do it safely. But once again, you need to do it under the guidance. If you've got cardiovascular issues, you need to do it under the guidance of a physician. Make sure it's safe. And I already talked about adaptability. So adaptability is when you're doing an exercise program, try to do it in an environment that is challenging. So if you're cycling, people that like cycling and haven't cycled for a decade, I say go to a gym or buy an exercise cycle and one of those ergometers and put it in your house and spin around until you're comfortable and you kind of get your muscles training, you increase your strength, and you're going to be bored out of your mind. It's just horribly, horribly boring. But do that first. And then once you get some confidence and once you're feeling stable, then move to the bicycle outside, go around the street, go around the neighborhood, go into the RAGBRAI across Iowa. So I see a wave. I'm going to tell one more anecdote before we finish. How many people have heard about the RAGBRAI ride across Iowa? Everybody's heard that. So there was this story about a neurologist from Cleveland Clinic, Jay Alberts, who organized a ride across Iowa with a group of people with Parkinson's disease. So at the beginning of the ride, he looked at this gentleman, and he had to sign in. He had to sign his name at the start of the race, and so he could barely sign his name, hypokinetic, classic Parkinson's signature. And then Jay rode with him on a tandem bike, so they're on the same bike riding together, and Jay noticed that day 2, the gentleman was kind of moving a little bit better. And then at day 3, he was moving even better. And on day 4, he didn't take his medications. And at the end of the week, he was feeling fantastic. He just did 1,000 miles of riding, and he was feeling fantastic, wasn't taking his medications, and there's basically a picture of his signature at the end of the week, and his signature looks 100 times better. And actually, this got Dr. Alberts interested in cycling and exercise as a therapeutic for people with Parkinson's disease. And this is not just a lone anecdote. We've got people probably in this room, people in this city, who've seen some remarkable turnaround in their disease with a prolonged program of exercise, and it's really changed their lives. So that's the take-home for you, is take it on safely, keep moving, and try to progress. So with that, I will finish. If there's any other questions, once again, thanks to the Parkinson's Foundation for supporting our program, for inviting me here, and enjoy the rest of your day. Thanks.